Hi, my name is Chris Sadler. I'm the Director of Human Resources for the Sun Prairie Area School District. And today I'm going to be describing the situation report for our healthcare insurance update and recommendation on October 24th, 2022. So I'm going to go down the report just a little bit, and I'm going to talk about historically where we have been and kind of where we are now. So in the past, we always have staff volunteer to be part of our committee, our health insurance committee, and they give us feedback and input into our decisions when we're trying to support our employees who are benefit eligible on how best to support them through health insurance and other benefits that they are in line for. So in 2018, the school district received a 5-year rate hold offer from Dean on the HMO plan with just minor adjustments throughout those 5 years. Since 2019, premium rates have not increased, and claims have increased during that time and stayed higher than the desired target. Putting the employee wellness clinic into place has positively impacted claims utilization, which that was our goal, and that has happened. However, we are consistently at about 120% medical loss ratio in the last year or two, which means that we're consistently spending $1.20 for every dollar in premium paid. Each employer's goal is to be no more than 88 cents in claims for each dollar in premium paid. So that would be an 88% medical loss ratio. Our MLR creates a concern to a point where employers that do not have rate caps in place, if they would be at the same point we are, they would be receiving a 20% rate increase with a medical loss ratio similar to the one that I just described for our district. So on January 1st of 2020, the district did add an alternate HMO. And then on July 1st, 2020, we introduced an employee wellness clinic. Both of those pieces of strategy around an alternate HMO and then putting the wellness clinic in place was to secure a medical loss ratio based rate cap for 2024. The medical loss ratio can improve if we spend less on medical claims by improving health and increasing wellness clinic utilization. Since our wellness clinic does avoid claims hitting the medical loss ratio at 100%. The plan changes being proposed by the committee are designed to start improvements on this medical loss ratio. As we continue to look forward to December 2023, when we're looking at the next step for past our 5-year agreement with Dean, we want our best rates possible in 2024 and beyond. So the current rate hold does expire in 2023, and we want to kind of be proactive with both continuing to increase our clinic utilization, but also looking at ways we can adjust our current plans in order to show good effort towards reducing our medical loss ratio as much as possible as we get ready for 2024 when our current agreement comes to an end or expires. So our proposals include the following. The first part is looking at our traditional HMO plan, which we've been offering now, and doing a co-insurance adjustment, which ends up being a 4% premium savings for the employee and district. This is a change from 100% co-insurance to 80% co-insurance, and then a deductible co-insurance limit moves up to $400 a single and $800 a family. Currently, it's $200 and $400. We would also adjust the copay for emergency room visits to $100 to $250 per visit, which ends up being a 0.6% savings for the employee and district. So we want to continue offering the traditional HMO and our alternative HMO plan that we have been providing for the last 2 years. We also want to add in something called a health savings account, and which is a new HMO plan that has a higher deductible with the health savings account attached to that, where the deductibles would move from $3,000 to $3,000 single, $6,000 family deductible, with $2,500 and $5,000 HSA deposits from the district each year to cover for those medical expenses within that plan. If those district deposits are not used, they do roll over and they stay with the employee until used, even after they leave the district. Which could be seen as a benefit for people that enroll in this plan. We are planning on eliminating the point of service plan and recommending that because the plan now has become very cost prohibitive and has a minimal participation. Staff have been informed over the last few years that the POS plan could be discontinued as an option. So when we think about the financial budget or resource implications of this, there is a 4.6% rate decrease on the base plan, which is traditional HMO. This will provide cost avoidance and increase in the ER copay. Right now, based on our current snapshot of employees enrolled in plans, these recommendations and proposals that have been put before you would save approximately $614,000 for the district as we get prepared for 2024. And again, the reason we're moving in this way is to both right now look for savings and cost neutrality with the high deductible HMO and HSA plan, but also again, this change is being recommended now to be proactive and better negotiating position to offset larger health insurance increases in January of 2024. Employees who opt not to take the district offer insurance are still going to be provided with an alternative benefit, which is $150 per month if you do not take our insurance. So on behalf of the superintendent and myself, the director of human resources, we recommend that accepting the plan recommendations to the committee as outlined above in this document. And this will allow employees a choice between 3 health insurance plan and a plan adjustments regarding coinsurance and emergency room copays. Thank you.